Hello, my name is Dr. Celeste Reese. I'm a board-certified family medicine physician specializing in urgent care. I'm so excited that you tuned in today to hear about race, gender, and cancer. So today, guys, we're going to be talking about how your race and your gender can affect whether or not you will be getting a diagnosis in cancer. The first cancer we're going to talk about is breast cancer. This cancer is growing in very large numbers in African American females. In the United States, there are about 240,000 cases of breast cancer that are diagnosed each year. When African American women are diagnosed with breast cancer, they are 41% more likely to die from breast cancer than other cultural populations. So let's talk about breast cancer and when we should start getting screened. Breast cancer screening typically starts when you reach the age of 40 years old. Unless you have extremely strong family history of breast cancer, we may start it at a younger age, depending upon, of course, that family history. That is where that comes into play. So, when someone develops breast cancer, what kinds of symptoms do they usually present with? Most patients that come in with breast cancer diagnosis may come in and say, I feel a lump or a mass in my breast. They may say that I have a very discolored and smelly discharge coming from my nipples. Your nipples also may be inverted. In addition to that, they may present and say, hey, I'm having some swollen lymph nodes that may be in my neck area or in my axillary underarm area. In addition to that, they may present with weight loss or fatigue. Most women that are given a diagnosis of breast cancer happens as a result of them having an abnormal mammogram. We recommend that you get this mammogram at least once a year. For some cases, there are women that will put it off and get it once every 2 years. We do recommend once a year, though, in those individuals that have strong family history. In addition to that, if you have strong family history, we may recommend that you get genetic testing. So make sure that you get and that you examine your family cancer history, have a visit with your primary care physician so that you know what you're at risk for and when you need to start your screening for breast cancer. Our next topic, cervical cancer. Cervical cancer is a cancer of the female organ called the uterus. It is a cancer that is examined by way of what we call a pap smear. This is a test that screens for cancer wherein a woman goes in and has an exam with her physician, and we obtain a small sample of cells from your uterus. We send that sampling off to the pathologist who will send us back a report that tells us whether or not they notice or see any cells that look like they could be what we call precancerous cells, or if there are any cells that are cancerous. There are treatment modifications that are available if you are to catch cells before they fully turn into cancer cells. If you have an abnormal pap smear, there are treatment modalities available to remove that portion of tissue that may look like it may form into cancer. To have this kind of test, you have to make sure that you see your gynecological physician on a routine basis. So when should we go in for a cervical cancer screening? At the age of 21 years old is the minimum age that we want you to go in for that cervical cancer screening. So let's talk about some of the symptoms that people that have cervical cancer may present with. The most common symptoms that women present with when they have cervical cancer is vaginal bleeding. Whether that vaginal bleeding is after intercourse, or some women may experience vaginal bleeding after they have entered menopause, at the point at which they should no longer bleed. You can also have vaginal bleeding that occurs with your cycle that is heavier than normal or bleeding in between your periods. This is also a sign of cervical cancer. In addition to that, you may get pelvic pain. These are all symptoms of cervical cancer. Cervical cancer is a cancer that has certain things that put you at higher risk for developing it. The most common thing that puts you at high risk for cervical cancer is having an HPV infection, and that's human papillomavirus infection. We actually have a session specifically dedicated to HPV that I recommend that you take a listen to at a later time when you finish the session. So, having the HPV infection is the #1 risk factor for developing cervical cancer. In addition to that, if you smoke, you're at increased risk of developing cervical cancer. As we get older, you're at increased risk of developing cervical cancer. In addition to that, if you have any kind of immune deficiency or if you have a herpes virus infection, you're at increased risk for developing cervical cancer. And lastly, the use of oral contraceptives for more than 5 years increases your risk of cervical cancer. So if you're out there taking oral contraceptive pills, make sure that you have a discussion with your physician if this is a correct decision for you if you have been taking oral contraceptives for more than 5 years. So let's recap that as far as the symptoms go. Anyone that is having abnormal vaginal bleeding, bleeding outside of the time of your menstrual period, anyone having pain during intercourse, as well as having pelvic pain are the 3 top risk factors and signs and symptoms that people present with when they have cervical cancer. So, in wrapping up about cervical cancer, we want to make sure that you get that pap smear at least when you turn 21 years old. You're going to get your first HPV test. That's a test if you have that human papillomavirus, which puts you at increased risk for cervical cancer at 25 years old and every 5 years thereafter until you reach the age of 75 years old. Our next topic, testicular cancer. This is an extremely rare form of cancer in the United States with less than 20,000 cases each year. But very important cancer for us to talk about because it is curable. So guys, listen up. Most of the time when people are diagnosed with testicular cancer, they can be cured. What is testicular cancer? It is a cancer of the male organs that produce hormones as well as your sperm, and that is the testicle. So it's a cancer of the testicle. Most of the time when men present with this particular form of cancer, they do not have symptoms. There are not a lot of symptoms. You may notice a swelling or a lump in your testicle area. Sometimes people may say that they have like a pelvic pain or feel a little fatigue, but it's not a rip-roaring symptom that you're going to have. It may be very subtle as a swelling or a lump in the testicle. The most important thing for us to remember here is if you are down there and you're examining yourself, and you should be doing that every day, and you feel something different, go to your physician and have it checked out. This form of cancer can be cured through surgery as well as chemo and radiation in certain cases, but this is a cancer that is cured 90% of the time. So the most important thing is being aware enough to make sure that we get the diagnosis. This is a cancer that is seen in people as young as 20 years old. So if you're out there and you notice, hey, I've noticed something weird in my testicle area, right? If you notice a swelling or a lump, we want you to see your physician right away to get that checked out. There are other conditions also that sometimes will mimic testicular cancer, when some people will sometimes get a torsion or twisting of their testicles that has to be released. So anytime you get any kind of swelling or a lump or anything in your testicle area, we want you to see the physician right away. This is something you don't want to wait on. Remember, 90% of those cases can be cured. Our next topic, prostate cancer. Prostate cancer is a cancer of the male organ called the prostate. This particular organ is responsible for helping to produce seminal fluid, which is a part of sperm. There are about 2 million cases of prostate cancer in the United States every year. There are certain populations, though, that this particular form of cancer affects a little more, and that particular group are African American men. African American men are 1.7 times more likely to die after a diagnosis of prostate cancer and 2.1 times more likely to die as a result of prostate cancer. Why, you may ask? A lot that goes into play of that includes environmental factors, things that they may have been exposed to. In addition to that, access to health care, and in addition to that, their access to good nutrition. All these things play a factor in this diagnosis of prostate cancer. So, when should we start screening for prostate cancer? Glad that you asked. So we typically start screening at the age of 40 years old. Sometimes in certain patient populations, we will start that screening earlier. And guess what that's dependent on? That is dependent on that family cancer history that we talked about in our first session. So if you missed this session, make sure you rewind and go back and watch it. Now, for men who have prostate cancer that's been diagnosed at ages earlier than 40 years old, we do start their screening earlier, typically about 5 years before the youngest age of your relative that has been diagnosed with prostate cancer, whatever that youngest age is. So, what does that consist of? What does it consist of if we're going to do a prostate cancer screening? You'll go in and see your physician. They'll do blood work. They may also do a physical exam on you. There are a lot of different ways that we examine and screen for prostate cancer. The good thing to know is that the earlier that it's diagnosed and caught, the greater the chance of cure and the lessen the chance of remission that you have. Lastly, how do we treat prostate cancer? It's typically treated through surgery plus radiation. Whether or not you get surgery plus or minus radiation depends upon your stage and where you are in your diagnosis. So remember that screening for prostate cancer starts at the minimum age of 40 years old, could start sooner. Very important for you to get that family cancer history. Our next topic, colon cancer. There are about 150,000 cases of colon cancer that are diagnosed in the United States every year. 50,000 of these individuals will die from colon cancer every year. Colon cancer is a cancer of your colon or of your GI system. It typically presents with symptoms of blood in your stool. You can have a distended or a bloated abdomen. You may have excessive gas. In addition to that, you may have a change in your bowel habits. You may have a more narrow stool. You may have a stool consistency that changes. Any combination or constellation of these symptoms may be a diagnosis for colon cancer. Colon cancer screening typically starts at the age of 45 years old. This is where, guys, again, that family cancer history comes into play. If you have been diagnosed with colon cancer at younger ages in your family, because there are some families, unfortunately, that are diagnosed as young as in their 30s, you want to talk with your physician to make sure that you know when you need to start your screenings for colon cancer. So, typically starts at age of 45 years old. Typical screening is through a colonoscopy. This is a procedure wherein they'll take you in, they'll give you some anesthesia to kind of make you a little drowsy, and they'll take a probe and they'll look at the insides of your GI tract to make sure that they do not see any signs of colon cancer. They may see what we call polyps. These are typically benign growths that are found in the colon that they will examine to make sure that there are no precancerous lesions. So, I've had several people ask, well, what are some things that we can do to help decrease our risk of colon cancer? Glad that you asked. One of the most important things you can do even now as a young individual, young college student, that you can do is watching your diet. Diets that are higher in red meat and pork are more likely to have a colon cancer diagnosis. Don't forget, it takes at least 5 days for your body to digest steak. And people who eat a lot of steaks on a routine basis have been found to have increased risk of colon cancer. So keep that in mind as you're making your nutrition choices. In general, as with all forms of cancer, you can always decrease that cancer risk by making sure that you pay attention to your nutrition, making sure that you pay attention to your exercise, and making sure that you give attention to your water intake. Exercising at least 150 minutes of cardiovascular activity every week helps to mitigate or decrease risk of spread of cancer as well as other medical issues such as stroke and heart disease. In addition to that, we want to be making sure that we're drinking plenty of water. Water helps to rid our bodies of waste, viruses, and other particles that make our body congested or make it more likely to make your body more likely to turn on a cancer cell gene. So making sure we drink plenty of water, making sure we exercise on a routine basis, and making sure that we are following a diet that is high in vegetables and high in fruits helps to decrease the risk of colon cancer as well as other cancers. Thank you. Don't forget, we hope that this session has been very helpful for you, but we don't want you to forget that we have a 6th session called Ask Dr. Celeste, where you can ask any questions that you have about any of the information that we've presented. So don't forget to tune into our 6th session. Thank you.